right, we have two experts with you today, Dr. David Gutterman, Dr. Jenna Mendelson. Both of them are concentrating on your mental health wellness. So we want to make sure that you text your question, whatever you have. There's the number on the bottom of the screen. In the meantime, Dr. Gutterman, let's talk about COVID fatigue, because so many of us are experiencing this fatigue and frustration. How do you manage those feelings in a healthy way?
It's a great question, because I think all of us, Tanya, are experiencing COVID fatigue. I don't know anyone who isn't. And people are managing it in different kinds of ways. The way that it's not healthy is to sort of throw your hands up and say, you know, I'm just tired of this and I'm going to pretend it doesn't exist. It does exist. We're all in this together. And I think that the positive frame we need to have is that all of us can do a small part, but we are all have the responsibility to take care of ourselves and each other. And there are things that we can do that will make a difference. It doesn't necessarily feel like it on a day-to-day basis. But again, as I was mentioning earlier, keeping your routine as much as possible, staying up to date on what the latest information is, and maximize those opportunities to connect with other people. And just remember, again, the stress that you're feeling is being felt by everyone, and that it's perfectly normal to feel some degree of stress, but we need to be empowered to do whatever we can day to day, again, to help ourselves, and help each other, and help our community.
This question is coming in, and it says, are more people having panic attacks now than they were before the pandemic? And Jenna, maybe you can start us off with, I don't know if you're seeing that in kids more often, that kind of thing?
I don't have a statistic to answer that question, but I think it's reasonable to hypothesize that yes, because it does seem that psychopathology in general, certainly anxiety, has gone up for children and adults since the pandemic. So I think I think we could probably say yes to that.
I would agree with Dr. Mendelson that it's true that anxiety, we know for sure that anxiety is much higher than it was before. Panic is an aspect of an anxiety, and you know, we're seeing a lot more anxiety, and I think it's reasonable to assume that people prone to panic, you're going to see a bit more of that.
And can a panic attack look very different in different people? Maybe we should talk about that, because maybe sometimes people don't know that that is what they're experiencing, or that is what their loved one is experiencing, and they're not able to recognize that.
Absolutely. Often when people are having a panic attack, it seems to come out of nowhere, and it really feels like there is a medical event happening. You know, panic attacks are often discovered in the emergency room because people think they're having a heart attack, but they can look different for different people.
And it's often, again, as just mentioned, there are these physiological components to panic. So it can feel like a cardiac event. It can feel neuro. I mean, there are a lot of different physiological aspects of panic, which is why so many people end up, calling their doctors or going to the emergency rooms when they're having a panic attack. But panic attacks generally are relatively rare compared to a generalized anxiety disorder.
This person says, how do I talk to my older family members about mental health? They believe it's a problem, but they don't think that they need help because, well, that's just the way life is.
Well, that's a great question. You know, generationally, sometimes there's a lot of stigma associated with mental health. One of the things I will say that I think has been really one of the more positive things to come out these last couple of years throughout the pandemic with regard to mental health is that so many high-profile people have stepped forward, athletes and actors and people in the public eye, talking about mental health to destigmatize it. It's difficult generationally if it's of a generation that isn't really used to talking about these kinds of things, but I think we can normalize it by talking about our own mental health experiences, sharing with others stories and experiences. But I do think that slowly but surely we're all starting to realize of the importance of mental health, and it's really coming to the forefront these past couple of years.
All right, we're going to also talk about How do we know when our kids need to see somebody? We're going to be talking about that as we come back from the break. Remember, you can text your questions in. We'll see you in just a couple of minutes.